5 years of medical school, months of unpaid internship and hundreds of thousands of shillings. These are just some of the requirements that potential doctors have to fulfill before they can be posted to treat the sick of society.
But in Kenya, the grueling journey hasn't always resulted in an equal pay package, and once again, doctors are downing their tools to demand better pay. NTV's Brenda Wanga spoke to a young doctor on why they're on strike.
Under different circumstances, Dr. Rowena Njeri will be a happy, fulfilled woman with the job of her dreams, helping take care of the sick. But she, alongside hundreds of others who answered the call to be doctors, are anything but happy.
We are suffering right now by being out of work. We are risking our jobs. We are risking not having a source of income.
Rowena's journey to this job started with her good grades in KCPE that landed her in a national school and eventually in medical school. 5 years later, she was a full-fledged doctor serving the masses in Kangema Sub-County Hospital. But the satisfaction she hoped to get from her dream job is turning into a nightmare.
The last thing you want as a patient is to meet a tired, hungry, sick doctor. A demotivated doctor who is so not interested in the job that they're performing that it's like they're doing bare minimum.
But that is the reality of life for the hundreds of doctors serving in public hospitals.
You have to struggle, people take loans, it's time for school fees. Doctors fall sick. Well, personally, I just depend on NHIF. I don't even have medical insurance.
The doctors are demanding the implementation of the 2013 CBA that saw them awarded a hefty pay hike. The government has instead been giving the doctors piecemeal allowances hikes, but leaving the CBA terms untouched. This, according to the doctors, is leaving the general public at a disadvantage because the doctors have to find ways of bridging the shortfall.
Doctors have to work 2 jobs to sustain their families. What happens if I come to a public hospital morning hours, then dash in the afternoon to a private facility? It means that I'm not giving my public patients the full attention and support that they need.
In the current setup, a doctor straight from college earns about 40,000 shillings as basic salary, an amount that they say is barely sufficient to make ends meet. That, coupled with the hazards of the job, including long hours and poorly equipped facilities, means that the doctors are not only struggling to survive, but also wasting their skill set.
So you're there, you're like a chef, you've studied well, but you're in a kitchen that's empty. There's no equipment, you're not applying your skills.
Rowena maintains that she would rather be back here at her station in Kangema tending to the sick. But for a doctor who can't afford her own services, the strike is the only way to redeem the standing of the profession by ensuring that the caregivers get a decent pay and a shot at a decent life as well. The doctors and nurses are hopeful that the government's response to their strike will come in the form of the loosening of purse strings here at Treasury that will result in what they say is a long overdue award of their pay hike. Brenda Wanga, NTV, Nairobi.